Well, it is May, which means it is Mental Health Awareness Month. And oftentimes, those adolescent population, they're the ones that are left out of the treatment discussion. Not all the time, but often enough that we are having this conversation today. Joining me now is Shannon Bush. She's the director of the Specialized Treatment Facility. How are you today?
I'm doing well. How are you?
I'm well. Thank you for joining us. So tell us a little bit about what you do.
Well, Specialized Treatment Facility is a state-operated psychiatric residential treatment facility here in Harrison County. We serve adolescents from the ages of 12 to 18 years old. We are an inpatient psych, so the residents stay with us for a little bit of time.
So what is the common challenge you find most often with the clients or the patients that you treat?
Oh, my goodness.
It's kind of a big question, right?
Typically they come to us because they're having some sort of behavioral difficulties either in their home, at school, or maybe in the community. They may be having some outbursts, things that they may need their medications adjusted, and so they may be coming from another hospital situation, so they're stepping down to a residential program before they go home. And so our program will work with them on their behavioral health needs as well as their education, because we also have an on-site school.
So we have some individuals that are watching right now that may not know what some of those like introductory signs are that maybe their child might need some care. What would they be looking for?
Oh my goodness, they might be looking for, is the child struggling in school possibly? Getting into trouble in school, having some emotional outbursts. Does your child seem to possibly be depressed in some way? When a child comes to our program, we are never the first place that they come to. Our children usually have a history of other treatment options before they step into a program like ours, because ours is considered long-term. So typically our children have a real well-defined history of having been in other mental health situations.
Okay, they're not calling you first. That's good to know.
They are not calling us first, no.
So basically, what you're telling me is that your patients are referred to your facility?
Yes, they are. They are referred to us either from another hospital, from an outpatient provider. Parents can refer. School counselors can refer, but then there are other things that we definitely have to have from another provider, such as a psychological evaluation, an IQ, and we get notes from other hospitals and that type of thing to see if the child, if our program is a fit for that child.
Gotcha. So what is the duration of treatment for, or, I would imagine it all varies based on the patient. What is your standard duration of treatment?
Our average length of stay is approximately 4 to 6 months. We will have a few children who may stay less than the 4 months, but the majority are there roughly at that 6-month stage. Every now and then we will have someone who stays well past a year.
And for these students who are in school, are they getting that education while they're there? Does that part continue, or is that part paused while you're treating?
It continues. STF has an accredited school. We are accredited by the Department of Education, so our teachers have to be certified like teachers in any other school. We are certified as a non-public school. However, the work that the kids do with us, it also goes right back with them home when they go to back to their community school. Some of the difficulties that we do have is because we serve 12 to 18-year-olds, we have various grade levels that we are attending to, but we manage to do it.
That's fantastic. I didn't know this was even an option. So if parents are, if they're looking into this, if this might be the next step from them in their child's process, what does it look like from the time that the child arrives to your facility? What does that process look like from beginning to end?
We will do an extensive intake with a multitude of assessments just to see what the child's needs are, what the parent wants to work on, what the child wants to work on. We have monthly treatment team meetings, so the parent is part of the treatment team. The child is part of that treatment team. So they help develop the treatment plan. And so that's pretty much what works for, guides the process for everything that goes on with the child, is that treatment plan.
Let's talk about your staff. Are you looking for, are you in a recruitment phase right now?
Yes, we are. We are really looking for direct care staff. And those are the people who are with the residents all day long, from the time they wake up in the morning, throughout the evening. They go with them to rec, go on with them to outings, doctor's appointments, what have you. But we are heavily recruiting for direct care staff. We have several openings on all 3 shifts because we are a 24/7 facility. So we have an A shift, a B, and a C shift.
And in terms of requirements or prerequisites, what does that look like for these staff members?
Our staff members have to be at least 21 years of age, and depending upon their experience, we have different levels of support care professionals. So we do background checks, and we have to do a registry check on the child abuse registry as well.
Now, is it oftentimes that you're treating a patient that you end up, or you potentially uncover other issues, or is it just focused on specifically the reason they're there?
Oh no, that's one of the reasons why we do so many assessments, because we do look at, are there other things going on? And if there are other things going on, if it is something that STF cannot treat, then we will do what we can to get that child to additional treatment, possibly to another program. But we also treat, if we come up with health issues, physical health issues that may be involved with the child, we'll take care of getting them to ancillary doctor's appointments or whatever else, physical therapy, occupational therapy, whatever it takes.
What are your patients saying about this program?
First of all, they're adolescents, so
you're adolescents. What are your
they don't want to be there.
What are you,
most of the time.
Well, that's a huge piece of it that I didn't even think about. Yeah, they're not trying to be there.
Yeah. We're the adults,
right.
So we don't know what we're talking about. But no, we do have children who are successful when they leave us. They realize that there is something going on with them that they want to help manage. This doesn't mean that they're wrong, that they're broken, or anything like that. They just need to learn how to do some things differently. Yeah,
I guess, and May is Mental Health Awareness Month in May is designed to help, break down that stigma and help people to become aware of the signs and the symptoms of when somebody needs help. And I think, speak to the fact that it's okay to not be okay.
It is okay to need help. It is okay to seek that help. It is okay to get and accept that help. When we're working with our young people, we're also working with their caregivers. One of the strong points of our program is family therapy, which we emphasize because we realize at some point that child is going back to that home situation, whatever it may be. So we'll work with the family. Again, that's not to say anyone's wrong or anyone's broken. We just may need to do things a little bit differently from time to time.
And you have to bring that family into the mix because that's, like you said, they're not going to be there forever. They're going to go back home and you have to make sure that has been addressed.
Yes. So that's one of the reasons why the family is also a part of the treatment planning team.
All right, let's listen. UC Specialized Treatment Facility. This is Shannon Bush. She's the director of the program. You see that information there at the bottom of your screen. Give them a call if you have any questions. It's the time of the year. May, like I said, is that month, and we're trying to raise awareness. And if you think it's ready for your time for that conversation, definitely give them a call at that number you see at the bottom of your screen. Reach out to them on their website, and they'll be happy to help you. Shannon, thanks so much for joining us.
Thank you.
Absolutely. Thank you very much.